And with that, so there's no cells in the product
Most
typically.
products. There are some products with cells. Like we have a Wharton's jelly acellular and we have a Wharton's jelly cellular. And we demonstrate through third-party testing the viable nature of the cells that are present in those products. But the other products are just structural, Wharton's jelly, or in the case of the purified amniotic fluid, it's just amniotic fluid, soluble proteins, exosomes, and that's it.
Okay, interesting. And then when you go to like Mexico or South America or something, when you purchase like a package, it's sold kind of by the cell count. Those would be cellular products, right? Or
They're sold as cellular products, but I've never seen a single viable cell in any of those.
okay.
You don't, when you go abroad, you have no idea what you're getting because there's no data. You're at the mercy of whoever's giving it to you. Do they work? Yes, they sometimes work, but not in the way that you anticipate. This is not regenerative medicine. If you took a bunch of cells and you shook them up and killed them and turned them into trash and injected that into somebody's body, it's gonna do something. That's how PRP works. And for the most part, and Chris isn't gonna like this, but for the most part, that's how bone marrow injections work as well. It's an irritant. You put it in a space that it's not supposed to be, it irritates that space, it elicits an immune response. And so then your immune response is responsible then for coming in and sort of cleaning everything up. And as a byproduct of cleaning everything up, you get a repair mechanism. But the older you get, the least well it works. It doesn't work as well because your immune system is responsible for doing that work, not the signals, because it's the same signals in your body. You've got bone marrow already. It's not doing anything. It's not fixing anything. It only works because you take it out, you shake it up, you kill a bunch of cells, you inject it in, it causes an immune response that then the body responds to. But when you're 20 years old, that works really well. When you're 40 years old, 50 years old, it doesn't work as well. And that's when you need the young signals. And that's why I focus my career not on bone marrow, not on adipose. These are excellent tissues that live in the body doing specific jobs. But when I want to talk about regenerative medicine, I want those young signals to inform the body, give it the resources, the raw materials that it needs to heal itself. And that's all it's doing.
Any other comparisons between maybe on the, I don't know how far you can go with this, but any comparisons on the efficacy of your products versus PRP, BMAC, anything that it's way better suited for being applied in the field that you're like, oh, we should never use PRP for that. It should always be us, or vice versa.
Well, PRP is really a young person's tool. Again, the way PRP and BMAC works is an irritant. There's nothing special in PRP. It's already in your body. You've got your blood is full of this exact same platelets all day, every day, and it's not healing you. So why does it heal when you take it out, shake it up, and concentrate it? Why does that work? It works because when you concentrate it, all of those immune activating signals and all that debris that you inject into the air elicits an immune response. So if you're young, if you're 20 years old and you're an NFL star, you have a really good immune system. So you inject PRP in there, you're going to activate that immune system, you're going to get a good response. If you're 50 years old and you're obese, you don't have much of an immune system. So, using BMAC or bone marrow or a PRP isn't going to work as well because it's exclusively relies upon the host immune system. There's nothing magical that it's providing. It's not bringing anything new. It's already in your body and it's not doing anything. The only thing it does new is set off a bomb. Sets off a bomb that your body then has to react to. So, the perinatal products in comparison have those young signals. So when maybe I don't know if I can share my screen, but when you get older, you lose these signals in your body. That's why we get wrinkly and our joints hurt and we have to get surgeries and all these things. We lose the ability to heal. But when you give those young signals, just like heterochronic parabiosis, the body has the tools. It has the instruction manual in the form of the RNA, and it has all of the resources to say, okay, I'm being activated. These are new tools that I don't normally have that I can now use to heal. And you heal so much faster, so much better than relying on solely on your immune system responding to debris.
The counterpoint to that I've heard from more BMAC PRP focused companies is that there's the risk of rejection from the host. So, but are they
Show me the paper.
immunoprivileged or
Show me the paper. There's no data to support that whatsoever. They're not immunoprivileged. They're immunoevasive. So yes, they are not completely invisible to the immune system. They do interact with the immune system, but they are privileged. They don't elicit the graft versus host response. We've been using these products for a very long time, and we've had no adverse events. The Pew published a report a few years ago now saying the FDA must act. Regenerative medicine is so dangerous, and I think Chris posted it everywhere as well. They reported that 360 people over the course of 16 years reported adverse events. That's 22 people a year reporting an adverse event. But when you look at the adverse events, they were the ones like what we were discussing before. Those 19 people that went to hospital, that was because the product was contaminated. It was contaminated with bacteria, and bacteria got into the injection. That this other clinic, the blinded 3 people. All of these data go into that thing, but the products themselves are inherently safe. They're antimicrobial. They're incredibly safe. They're designed by nature, and we don't have any adverse events unless the person injecting it screws it up. You see 1,700 people a week are killed by FDA approved drugs because some of those are dangerous and there are inherent risks when you intervene with patients. But these products on the scale of everything are so incredibly safe that it just makes no sense that people say, that they're so dangerous. Show me the data because every single datum that is out there contradicts that statement.